learned even more about each of you from the activities we did this morning. And so now we have the pleasure, we have two pleasures. Dr. Ann Cochran, you all should know her, yes. And Dr. Ruth Lubic. Dr. Ann is introducing our keynote, our premier speaker, Dr. Lubic, by way of Washington, D.C. So we have some people from Washington here. And we are about to dive into learning more about serving families. We're going to be learning more about nurse-midwifery. So I'm going to be quiet and let Dr. Ann take it away.
Yes. Good afternoon, everyone. I'm delighted to see you, and I'm delighted to bring you greetings from the nation's capital. And it is such an honor and privilege to introduce Dr. Ruth Watson Lubic as our first premier speaker for Diversity Impact. Dr. Lubic is a nurse midwife and a passionate advocate for high quality care of women and families, particularly in freestanding birth centers and in underserved, impoverished, and diverse populations. Dr. Lubic brings a lifetime of achievements and experiences as she talks with us today. Her education includes preparation as a registered nurse from the University of Pennsylvania School of Nursing, nurse midwifery education at Maternity Center Association, and a Bachelor of Science, Master of Arts, and Doctor of Education in Applied Anthropology from Columbia University Teachers College. She was part of the Institute of Medicine's first official medical delegation to the People's Republic of China in 1971, and the only nurse in that group. Also in the 1970s, Dr. Lubic became General Director of Maternity Center Association, now called Childbirth Connection, and opened the first state-licensed birthing center in the country. Eventually, the Morris Heights Childbearing Center opened in the South Bronx, bringing quality obstetric care to underserved, low-income women there. Now, excitingly, Dr. Lubic was the first nurse recipient of a MacArthur Fellowship in 1993, and we know that better as the MacArthur Genius Grant. As a MacArthur Fellow, she established the DC Developing Families Center, a social services and healthcare collaborative in an area of great need here in the nation's capital. She's received honorary degrees from at least 8 universities, as well as dozens of awards. She was elected to the National Academy of Sciences Institute of Medicine and received its Leinhardt Award. The American Academy of Nursing named Dr. Lubic a living legend, and the American College of Nurse-Midwives honored her with its highest recognition, the Hattie Hemschmeyer Award. The American Public Health Association conferred its Martha May Elliott Award, and Princeton University honored her with its Rockefeller Public Service Award. Phew. This is just a really tiny sampling of Dr. Lubic's professional achievements, though. But as to what Dr. Lubic is like as a person, I'll tell you, she is a delightful and gracious woman. And although I get the joy of being here with her in person, I know you're going to feel her warmth and passion even virtually. So please join me in welcoming Dr. Ruth Watson Lubic.
Let me welcome you back. We thought it might be good for you to have a little of the history of the freestanding birth center, especially as it has been branched out really to use with people who ordinarily would not have the privilege of using it. Because when we started in 1975, we were very successful, but we attracted only middle and upper class families. We did have some Medicaid eligible families, but they were mostly young professionals working on their doctorates and needed to have some Medicaid support. So, but then after, that was 75 when we opened on 92nd Street in Manhattan, which is called Carnegie Hill. It's a high rent district. And even though the Harlem and East Harlem are very close by, and we brought in groups of women and families from those areas to see if they would be interested in using our services. They said that they really liked the services, but they did not belong in Carnegie Hill, which is what the name was given to the area where we were. So it took us 8 years, but we finally found a place to do a birth center in a low-income area where we could really work with diverse groups of people. Mainly in this, you'll see, we're going to show you a film called Hope Reborn, Empowering Families in the South Bronx. And I want to tell you that I learned a lot from those folks in the South Bronx. I knew that we could make the outcomes better, but I had no idea about the empowerment factor. So I guess, Anne, what we can do is go ahead with the film now, and you can then tell me what you think about it. I think I should chatter.
Are you getting the screen sharing organized, Elliot?
Yep, it's coming up in just a moment.
Thank you. Mute on our end.
In 1975, the Maternity Center Association opened America's first demonstration freestanding childbearing center on New York City's Upper East Side. Conceived and directed by Nurse-Midwives, the CBC soon became the model of safe, satisfying, and cost-effective maternity care for other centers throughout the United States and the world. Based on the overall success of the CBC, MCA opened a new childbearing center in 1988, the first to specifically address the needs of families living in inner-city neighborhoods. Families who used the center services were inspired to form a community action committee, which led to important social change in the community.
It was an experience above and beyond anything I could have imagined. It's the atmosphere that is there. As soon as you come in, you feel like you're alone. Because the staff treats you like you're a person. My needs and wants are very much important, and they're looked upon as priority number one.
It's opened up a lot of doors to me. I have more confidence because I was told that I could do anything that I wanted to do by several of the midwives here.
It made me think that it made my community better, and that since it made my community better, that I can do something to also help my community to make it better, a better place to live and a better place to raise children.
This birthing center is one of about 200 birthing centers that exist across the country. And I'm a nurse midwife, and I'm director of midwifery at this birthing center, which has now been open for 3.5 years. And the birthing center that hired me to build this is located in Manhattan, called the Maternity Center. They've had about 3,500 births since they opened in 1975. We've been open, as I said, about 3.5 years, and we have had about 330 babies be born here. Our view is that about 95% of women who live in this country should anticipate normal pregnancies and normal births. Birth is a joyous time. It's one of those great moments in everyone's life, and it should be shared with the people you most want and need with you. Are you having any kind of contractions? Any sense that anything different is happening?
My stomach gets tight.
Are you walking every day?
No.
Okay, you gotta walk. Walking is excellent exercise, and you want to keep active. It will help you with your sense of well-being. It's good for the baby, and it's certainly good for labor. Good, 140 beats per minute, which is just right. So we will come back next week.
A little scared.
Well,
Yeah, a little bit, but
You're like, we'll help you. It's a family event having a baby, right? So you.
feel good.
You want to be there?
Yeah, I'm gonna be there. Gotta be there.
That's right. That's right. Does that make you feel better?
Yeah. It makes me feel better because I have my family around.
Vanessa's for next week, okay? Unless she has her baby first.
During the time when a woman is pregnant, it is most important that she be understood, she be sensitized, she be felt. As we all know, her whole being is elevated while she's pregnant. And it's very important for her security, her to feel safe that this baby's going to be all right and she's going to be all right. It's very important to her to be sitting in front of someone at every prenatal visit that feels that.
They treated me like a human being. I had gone to other clinics to receive prenatal care initially, and I live in the South Bronx, and it was something that I went to a lot of clinics that were in the South Bronx, and I didn't feel that the care was, I wasn't treated with dignity. The Childbirth Center was a place that treated me as if I were an intelligent human being. When you walk in, you're able to get your own chart, take your weight, do your urine, and record the results yourself. And you're able to decipher your chart yourself and see how you're doing. And I felt power from doing those things. I felt like I was taking care of my pregnancy.
Good. Well, we're at the end here of the tape measure, so I think that means birthday soon.
So you get the patient education, you get the diet, you get the nutrition, you get the stress management, you get the medical support. And in a birthing center, you don't have to ask for it. It's there because of the nature of the birthing center. And once you are a part of it, you are part of a system of nurturing. And all of those questions are answered simply by virtue of the fact that you are there. And that empowers you because it doesn't alienate you. Women all over the world should have alternatives for giving birth in hospitals. And we're lucky that maternity center decided to put this one right here.
This is the South Bronx. We are definitely a medically underserved area. We don't have enough doctors around here. We have the second highest infant mortality rate in the United States. They kept saying you can't put a center in an area like the South Bronx because minority women are all high risk. I'm here to say that not all minority women are high risk, okay?
Hi, my name is Gladys Olivier, so I'm from the Childbearing Center of Morris Heights. Do you know about us?
The majority of people around here are good people, hardworking people, people who get up early in the morning and go to work. The people just need a place where they come and get themselves together and go on and continue to change this neighborhood. And that is basically happening. We find, and we knew this was going to happen, that there were a lot of women around here who had the knowledge, who had the smart. All they needed was somebody to guide them. So that's it. I have a talk to my amiga también. Okay. Muchas gracias. Okay. Community action committees are saying for the mothers that give birth with us, participate and to do things in this community. I become so very involved in the childbearing center. When after I had the baby, I used to do a baby exchange. I would go get clothes from people, go get cribs. They didn't need to give it to people who didn't have a house, didn't have a bed, didn't have clothes to put on the baby. They was home with the baby wrapped in towels. So we had a baby exchange, bringing in old stuff to give to people who didn't have. We began, as Gladys had shared with us before, mother support groups. We would have meetings here every month where women can come in and talk about their problems, talk about their joys, talk about their questions. We have medical people come in and talk about concerns that women have when they have babies.
Your fame has spread far and wide, and I think, it's really the families that come to this center that are the most important people. So you're the most important people. But there are currently 6 different groups interested in establishing a birth center in Brooklyn. The window of opportunity is open, and people are getting big breaths of fresh air. So it's all very exciting.
Oh, most definitely, because even though in this one small community in the South Bronx, we have gotten excellent and high results, we know that we're only one small community that is repeated many, 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 many times over throughout throughout America, throughout the world. So no, this is not an isolated small project. We want to make it a national thing because healthcare is a national issue right now anyway.
This example, I just can't adequately explain to you how motivating it's been for other people too. And I think there are many health professionals around the country who had sort of lost hope that they could ever see a difference made in their communities where they're trying to serve too many people with too few resources. And what the birth center does is show that by turning over some of the power to the people, that everything multiplies and exponentially. The minute the families get involved and they bring their energy and their human resources to the project, just, it's unlimited what can happen.
What I got out of it, I got the strength from having a child, you know, and so it's another part. When I come home at night, I peeps in, you know, when normally I would come home, sit down, watch television, take a bath, but now I peeps in, I shakes the crib a little. So he can sit there, he can sit and think the news with me at night. So it's a real strength. I got a real strength out of it. It's just joy. It's a joy.
And there's so many other things that we do at the Childbearing Center that extends the life, improves the life, enhances the love. Not only in the family, but it makes you begin to build a society and within the community that it's important that I contribute to make sure that this place stays here forever.
It's kind of like, do I know what I'm asking for? Because contractions are what we need, so that's what I know.
So we're gonna start now.
When you come in labor, there are several things that happen differently than you might anticipate happening in a traditional hospital setting. For one thing is we will encourage you to walk around, to be active during labor, to be comfortable. She's still not having really regular contractions and it's a nice day. And she actually is probably not going to cross the block. She's just going to go up and down outside the center. But I think half an hour that might really stimulate her labor and it'll also relax her. And I'm trying to get her to have contractions every 3 or 4 minutes. That'll be strong, so she won't exactly feel like being out walking for 7 minutes.
Another one. That's right. Keeping the time.
I think that it's very important that the family be present during the labor and delivery because the mother, I really believe, needs the support that only the family can give it. Take a breath. I'm right with you. Take a breath and let your baby out.
Birth is a social event. In all cultures, it's a social event where women support other women while they are bringing forth new life. And that nurtures a need for women to have other women be there for them.
You're doing just fine. 1 contraction at a time, okay?
This is great.
I got him. That thing on his face, I can't move. How I got you.
We love Marissa.
After the birth, I could not believe I did it, you know, and that I was sitting there putting on the same clothes I had on 4 hours ago. Clean, neat, no tears, no screaming, no ripping, no tearing, no technology, no machines, no doctors, no sheets, no tools. And me and my normal self and my normal baby and my normal family were going to go home without a child.
That's very empowering. And that was the most empowering thing I have ever experienced in my life.
You feel that, you know, I did this. Well, I brought this life into the world. And if you feel that you can do this, you feel like you're giving life. And if you can do this, then you can do anything. You can do anything, even, besides work. You can run, you can get a job, and you can go to school. And that you can do whatever you want as long as you put your mind to it. And I think that's the best thing about the whole birth center concept is that it empowers women. And in turn, they empower their families, which empowers communities. And it grows and grows.
It can strengthen families. Birth can strengthen families. Because every time a baby comes into this world, hope comes back again, doesn't it?
You're on again.
I just wanted to point out a couple of things about that. The young woman who talks about having given birth is like giving life. And when I've used that quotation with groups, it's interesting that people have not really thought of it that way, that giving birth is giving life. And if you have given life, you can do anything. You can get a job and you can go to school and you can do whatever you want as long as you put your mind to it. So that's been a very important piece for the spread of birth centers, especially in low-income areas. I think some of you may be aware that there is a study going on, which was supported by the Centers for Medicaid and Medicare Innovation, and that a number of centers have been supported to be able to reach out to low-income families in their areas, because it really was mostly middle-class families that were looking for change, and that would make it a point to get that change. So I wanted to also to talk to you just briefly before I ask you for your questions about the difference between equality and equity. And equality is different from equity. And equity is the word that we're hearing now. And it has a base in fairness and the use of principles of justice to supplement law, whereas equality is just being the same. And so you have to grab onto that equity and take that with you when you go. I wanted to talk to you too about my experience with anthropology, because it was anthropology that set me on the road to really trying to understand people's ways of doing things. Now, one of the examples of this would be the fact that in the birth center at Morris Heights, there were families who had different religions, including Muslimism and so forth. And there was a time when a Muslim family gave birth in the birth center, and they were invited to bring all the folks from their mosque in. It formed a big circle, and they passed the baby around from one to the other, whispering the words of Allah into the baby's ears. And that was important to that family. And I think it's important to us because it is important to that family. I also wanted to point out that when I went to Washington, or when I came to Washington, because I'm in Washington now, and after I had gotten the MacArthur Award, which opens a lot of doors to you, I made friends with people from a place called Carver Terrace, which turned out to be behind where we set up this newer center here. It took 8 years to really do the meeting of people around, including the government people, the people in neighborhoods, to get them to understand what it was you wanted to do. Because I understood that people like myself come along and they've gotten a grant for something, and they set up and they do something for you, which is good. But then when the money runs out, they run out with the money, and the community is left without the services. So I wanted to be sure that didn't happen in Washington. And so spent a good amount of time with this. But whenever I went to visit some like one of the city organizations or something like that, I would always take a member of the community with me. And I would ask them to please have a VCR available. You can see I'm dating myself now with this VCR talk. But and I would take Hope Reborn with me, and I would show it to the people, and to make sure that they understood what it was we were trying to do. But when I walked in the room, I would say, now, I know I'm the wrong color, and I'm from the wrong place. And that was New York. I was from New York, and I would say then everybody knows New Yorkers are crazy. But once they saw Hope Reborn, then their fears and their concerns were off the table, and we were able to move ahead. But it does take time when you're trying to set up a service like this in a low-income area. And I just wanted to be sure that you understood that. Then in Washington, I mentioned it took us 8 years to get things going. And finally, Mr. Heckinger, who was really, his family were the predecessors of the Home Depot, really. Anyway, he gave us the building that we have, which is an old Safeway supermarket. And so we needed to renovate it, and there was help from several sources to be able to get the money to renovate. The important thing about the renovation was that we had an architect who was not from the community. And one day, when we're near to the point of being interested in colors, what color we're going to paint the building and so forth, he came around and he had color chips with him, and he said, all right, now, Ruth, this is what we're going to paint the outside and so forth and so on. And I said, wait a minute, I'm not going to make the decision about what color this building is going to be. I need to get some of the women together to talk to them about this. And so we did that. And when the women were shown these color chips, they all said, no, that's not what we want. And so I said to them, well, what color would you like the building to be? And like, as one person, they said, lavender. And I said, lavender. And then I remembered that when we were in the Bronx and we asked about the decorations for the internal parts of the building and so forth, we didn't have control over the outer side. But when I had asked them about what colors they wanted in the drapes and things like that, the same thing, lavender. So I thought, well, it's time for me to find out why lavender. And so I said to the women there at the birth center in Washington, or at what was going to be the birth center in Washington, why lavender? And they, as one woman, they said, because it's peaceful. And it became apparent to me that I really didn't ever have the problem of not being able to permit my children to go out on the street to play, because the neighborhood was, while not an expensive neighborhood, was comparatively safe. So that's another important aspect of what's going on, to always ask the women what they feel, what they would like to have. Another example of that is that when all the money from the tobacco conversion came along, a lot was given to the DC Primary Care Association. And they wanted to get the safety net clinics, as we were called, to work with each other and to take certain things to other parts of the city. So we were working with an organization that mainly was involved in giving food to people in the city. And they wanted to come and be part of what we were doing. So we talked with the boards, talked, the staffs talked, and it seemed like we really were going to go ahead with that. And then I said to the fellow who runs Bread for the City, I said, you know what, we haven't asked the women. And he said, well, you're right, Ruth. Let me get one of our vans and we'll take a group of your women to see the other two places that we have. And we did that. And they came back to the birth center and into the conference room, and I went in and said to them, well, how was it? And they looked at me and they said, nope, they didn't want it. And so I said, well, what's the problem? And the problem turned out to be, when you go and you visit a place that's giving away food, you find a lot of people hanging around wanting to not only have food, but to be able to get other factors in their lives settled. So, but they were concerned because these people who are hanging around are often, they're mentally ill, they're drug addicted and whatever. And the women did not want that. They didn't want to see this happen to the birth center that they were already connected to. So I said to them, okay, we won't do it. And we didn't do it. But you have to prove to people that you really are taking their desires seriously in areas like that. So now I'd like to ask you if there are any questions in the audience that you would like to pose to me. You mean I have everything really perfect, huh?
What about your principles for a successful professional life?
Well, I hope that you all would like to have those. And I think that they are important. I don't know how long ago you were given those in circulation, but we could go over those, because the first one is to begin with the needs of the people you serve. Not your own needs, not the needs of your profession, but the needs of the people. And you can't find out what the needs of the people are unless you talk to them and find out about it. Then the second one is to take care of all the people of the nation. And we're not doing very well with that right now. Trust your caring instincts. There may be times as a midwife when you're with a mother in labor and everything's going all right, but something tells you that she's not going to be able to make it in this environment. So trust your caring instincts. And if you feel that more is needed, go and get it. Learn to tolerate uncertainty, because that's really the watchword in this country today. There's lots of uncertainty. Choose your professional colleagues for their caring philosophy, not their professional preparation. So we're seeing a lot now of professions working together, and that's comes out of a principle like that. Be aware that the medical model has failed to serve all the people of the nation. And that I think is something that there's a great deal of awareness about, especially in this time when there is such attention being given to maternal mortality. Avoid anger. It consumes energy and clouds your vision. Avoid bitterness against political opponents. Value the giving and receiving of truth. Strengthen your sense of humor. It can neutralize opposition and brighten the darkest days. Recognize the importance of persistence, because all these things that we would like to do for families in this country don't happen overnight. It takes persistence. Base a design for change on the best science possible, then test your performance. And we're all waiting very expectantly to hear when the Strong Start data are announced and circulated in the country, because the study that was done by the American Association of Birth Centers through no, what am I trying to say here? The Medicare and Medicaid innovation has shown some really remarkable results, and I think we're all going to be happy to see those. So you overcome the fear associated with leadership, and I think that that's very hard for many nurses, because if they're in a place where there's one hospital, and if they make a problem in that hospital, they're not going to have another place to work. They have to learn to work with people and to prepare for untoward events that might happen, but they can work together. So then the most important one, I think, is remember that the people you serve are your strength. Listen to them, and you will be rewarded. Thank you for reminding me about the principles. So, how much more time?
For you? So in the film, I was struck by some of the ways in the Morris Clinic that it was built into the model of care, the sharing of power. So the getting of their own charts, the weighing themselves, some of those things. And I wonder if you could speak a little bit more to, in your years now of experience, there are things I'm sure that come from the people you serve that help you to share power, but what are some of the things that you see are as very important that you build into the clinic setup around that?
Well, I think that what we're trying to do, and you correct me if I'm wrong, what we're trying to do is help people of all backgrounds and all of societal positions to feel that they can manage their own health, and that's something that is very important for them to do, to feel that they can manage their own health. The giving of the charts to families was a different thing to do, but it worked out very well. It gave the women and the men the feeling that they could manage their own health, and that they could interpret what was going on. I remember that when we first opened and we invited men to come in to the classes and everything, they were not used to that. And many of the men did not have an understanding of what the anatomy and physiology of pregnancy and birth was, and it was very enlightening for them to do that. And so it was a good experience for us and for them. So, I think that all you folks must know all these things already. Do you?
Did that sharing of power turn into the centering model of pregnancy? That's right. That's what it grew into. How did you spread that out to other birth centers and like spread the news of this model?
Did that centering the centering?
Oh, the centering pregnancy is a different story because do all of you know Kitty Ernst?
Oh, yes.
Yeah. Well, centering pregnancy was not centering pregnancy when it was started, but it was started in our birth center on 92nd Street. And it was called the CNEP program. No, I'm sorry, it wasn't called the CNEP program. But anyway, Kitty really defined that and designed it and taught it. And so then we were looking for people who would help us to put the effects on paper. There was a big article in the New York Times about it when we had the first class. But it was a program that we were able to get to Sharon Rising and have her write some of the instructions for doing centering pregnancy, and she's done a wonderful job with spreading the whole concept around the country and using it in other respects than just the childbearing respect. But that's a good one. That's a good one, and that's one that Kitty deserves credit for. Anything else?
If there was one thing that you changed about your career, what would it be?
If there were.
Looking back, because a lot of us are starting our careers, so from where you're at, looking back now, what do you know now that you didn't know when you were starting out that you would change about your career?
What would you change? What would I change? Well, I guess I'd change my own life in the sense that I'm now 91. I would rather be at this at a younger age. But one thing I do want to point out is that in the center here in Washington, I think most of you know that we have early childhood development, and that has been has had a very positive effect here. And so what I would like to see is that there are more of the centers that include early childhood development with them, and that's something that it has to happen as yet. I know that there are, let's see, I really think there's not another birth center that's including early childhood care right now, but it does give a lot of effect to the families and brings the social aspects of the community together in a very important way. So I hope that will happen more often, that there will be that kind of venture into the early childhood development. How many of you are getting your experience in a freestanding birth center now? Just a couple of you. Did that happen? Why did that happen? Can you tell us? Why did it happen that there are just so few of you who are doing this?
Well, I work in a birth center, but notoriously they've only accepted students from one institution. And even though I worked there, I was made to feel like it was not even worthwhile to ask if they would take me, because I asked for other shadowing experiences and they made it just, I felt like there were just a lot of barriers even though I worked there, for them to allow me to shadow or to allow me to do even part of my clinicals there.
So how is the center doing? Is it successful?
Yeah, it's almost 2 years old. I work there too. We have 2 frontier midwives that are working there now, and one of them kind of put her foot down and went to bat and said that she really thought it was important because of the focus of our program to bring students in. So I'm going to be the first frontier student there starting in July. So yeah, but it took other frontier students to kind of be that way for us.
Maybe it will be of interest to you that on next Tuesday I'm going to the New York Academy of Medicine, and they are on to be given the first Urban Health Equity Champion Award. And it hasn't been all that long ago that some of the leading lights at the New York Academy of Medicine had me come into the building to sit down and talk to me, because obviously with my leadership in starting the freestanding birth center in New York City, I didn't know what I was doing. That was easy for them to see. So I went into the building, and we sat at a big conference table, and one after another of the leaders in obstetrics and gynecology in the teaching hospitals in the city explained to me why they thought we were going to fail, and I listened to them, but there were good people in the room. One of them was Dr. Bernard Pisani, who was the chair of OB at St. Vincent's in New York, and he had been raised in a family where the father was also an obstetrician gynecologist, and that was in the Lower East Side. And so he, as a boy growing up, went out with his father a number of times to help with the birth process with some of the poor people who lived in the tenements in there. So after everybody had their negative things to say, he sort of spoke up and he said, well, I don't know, I think they deserve a chance. So I think we should see what happens, because we had gotten permission from the state for a 2-year try at it, and then we had to go back with our data. And we did that 2 years later, and there was a big meeting of the Public Health Council, and so anybody could talk who wanted to talk, either for or against it. And so some of the mothers who had given birth with us were there, and they, of course, were very positive. And but some of the other physicians were not so positive. And at length, after about 3 hours of this, the Public Health Council, which is part citizen and part professional, voted, and they voted to give us permanent establishment. And so that was a big relief. But there was a neonatologist sitting next to me, and he leaned over and said, that's all right, we'll get you on the rules and regs. So it was done, but it wasn't done. But you have to keep at it. One of the principles relates to persistence. Now, I want to tell you in the time that we have left too about the need for my view of the need for cultural understanding. Because when I was a student at Kings County Hospital in Brooklyn, that's a midwifery student, there were a couple of things that happened that impressed me and that I've never forgotten. One of the things that happened was we were invited to go to obstetrical rounds, and so were the private practitioners in the community, because they were called on to help educate the residents in outpatient care. And so the man in charge, who was Dr. Hellman at the time, was reporting on the outcomes of the women who had been cared for in the midwifery service there at Kings County. And the outcomes were very, very good and very much improved. And then he asked for questions, and the first question was, and what are you saving? Material for the welfare rolls. And I was really stunned by that. And nobody chastised him for doing that. He was one of the community physicians who came in and helped out, and they were required to come to the rounds all the time. But the other thing that impressed me was that in attending women at birth, in those days, we would still go out in public health nursing uniforms and visit the women at home, the women we had cared for. The hospital was delivering 7,500 babies a year in a plant that was built to manage 3,500. So the women were being sent home in 24 hours from their stay in the hospital. Before they went home, they were taught to make formula to give to the babies, because in those days, this was like 61, 62, nobody was breastfeeding their babies. It was all bottle feeding. And but the women and the families who lived out there could not afford to buy commercially prepared formulas. So they were taught to make formula from water, Karo syrup, and evaporated milk. And so when I went out to visit this one mother who, with whom I had whom I had attended as she gave birth, I walked into the house. This was a Hispanic woman, and I didn't have the greatest in Spanish, but anyway, I walked into the house, and the baby was just in terrible distress. So I examined the baby and found that the baby was impacted, and was able finally to talk with her and find out what she was feeding the baby. And she was going to the grocery store and buying whole milk out of the case and bringing it home and heating it and putting it in a bottle. Now, why do you suppose she did that? Well, the answer was that her culture taught her that you never give babies anything from a can. So she could not really make the formula as she had been instructed to make it. And that was a very important lesson for me. So my husband had a classmate from Columbia College who had gone on into anthropology, who was constantly saying to me, Ruth, you ought to study anthropology. And I would say to him, why should I study anthropology? So after I had that experience with that woman, and I called him up on the telephone the next day and I said, I'm ready. When can I register for anthropology? because it is important to find out what the culture of the people you're serving is. And maybe it's not going to be acceptable to you, but maybe you can work with the families to find a way to help them to be able to maintain the strength of their own cultures in spite of the fact that we have different ones. But in order to just tell you how much that has meant to Bill and me, many of you know Bill as father, we actually have created an endowed scholarship at Teachers College where I took my anthropology. And preference is given to registered nurses or other healthcare professionals to study some anthropology. We're not talking about making everybody an anthropologist, but just to be sensitive to the fact that your culture may not be the culture of the people with whom you are working. And you should really try to find out what kind of a belief system the family has when you begin with a family. If you can do that, that's a good thing to do. So what else? Looks to me like you have all the answers out there. So, yes.
Okay, so when you built the birth center in, in a low income neighborhood, how do you make that a sustainable project when you can't, the income from the patients is not going to be from the payment, it's not going to be like what you need?
I'm having trouble. I'm having a little trouble with that one. My ears aren't so good. But.
So let's say that you have to build a birth center and you want to do it in an area where you know that you're going to be accepting predominantly Medicaid patients or cash pay or something like that. How do you go about approaching building a project like that and taking that on in a way that's going to be financially sustainable?
Well, I don't know if you've as yet gone to a workshop on how to establish a freestanding birth center. Have any of you done that? One has, because I think that's very important to get those questions answered. And the workshops are very inclusive of all kinds of things, of staffing, of space, of economics, the whole thing. And they're very worth attending to give yourself some strength about just going out and setting up a birth center in your back room or something. Did you want to say anything else, Ann, about that? Well, Ann just asked me if I wanted to say anything about the financial sustainability of the birth centers that I had been involved in. In the New York area, the birth centers, the first birth center, having an organization like Maternity Center Association to underwrite this and to help you to find grants from foundations is very important indeed. But when we went to the Bronx, I have to say that the politics came into it some, because in the years that we were in the Bronx, which was from like 1988 to 1992, New York State was still operating under an indemnity system of payment for health insurance. So all they did was ask us for our data, and then because it was a lot less, the cost was a lot less than hospital care, it was no problem to get the funding to come from the state. That when we got to Washington, it was Medicaid managed care, and that's a very different story. And so when we had one of the managed care companies come out to ask them about supporting us, they said, well, what are your charges? And so we told them what our charges were, and they said, well, we'll give you half. So that's very disturbing. And finally, the birth center here in Washington partnered with an FQHC organization, a federally qualified health center, where the largest problem that you have is tort coverage, but it's much simpler now than it used to be back in the beginning. And so that I think that it's an easier job today, but I think the persons who can tell you the most about it are the people at the American Association of Birth Centers through that birth center workshop that they offer. Anything else? Now I have a comment. I think you should not invite people with bad ears to come and speak. But it's been a real pleasure for me to to really to be asked to be part of what you're doing, and I wish that I could be there with you. Thank you very much.
Thank you.
Thank you, Sue.
All right, so we sign off here.
Yes, thanks. Thank you, Anne.
All right. Thanks, everyone. Great to see you. Have a wonderful time.
Okay, we will. Bye.